Hi everyone, today we're discussing pitting and non-pitting edema. What exactly is edema? Edema occurs when fluid builds up in your tissues, often in your feet, legs, and ankles. Edema can affect anyone, especially the pregnant women and adults of the age 65 or older. The treatment involves lifestyle changes, regular exercise, and changes in the diet. Edema is a medical term for swelling which is caused by fluid trapped in your body's tissues. Edema happens most often in your feet, ankles, legs, but can affect the other parts of the body as well, such as your face, hands, and abdomen. Now, whenever you go to the healthcare provider, he'll test an area of your body for edema by gently pressing their finger on a swollen area of your skin. And they're going to give it at least 15 seconds. So that's the pitting test. What exactly is pitting test? That the healthcare provider is going to gently press his finger, especially on your leg or closer to the ankle, because that's where normally edema develops. What exactly is edema? Edema is when the fluid gets trapped in the body's tissue, in the interstitium. So there will be resultant swelling. That resultant swelling is referred to as edema. So healthcare provider is going to gently press the finger in the swollen area, and this pressing will last at least 15 seconds. So it shouldn't be very abrupt, it should be gentle and prolonged for 15 seconds. After the pressure is released, a dimple will form. That dimple is referred to as a pit. And now this pit indicates that there is fluid built up in the tissues. Now there are two types of pits. It could be either a pitting edema or a non-pitting edema. So basically either the pit will form and it will remain, either the dimple is going to persist or the dimple will disappear. So it depends. Now there's a scale that measures how quickly the dimple goes back to normal, how quickly the pit is going to rebound after a pitting test. This scale includes grade 1, 2, 3, and 4. So, first of all, in grade 1, there's immediate rebound with 2 millimeter of pit. So, there's a very quick rebound. That's grade 1. In grade 2, you can see right here, this is the diagram. There's immediate, there obviously you cannot visualize right now, but there'll be immediate rebound, and the pitting will be 2 millimeters. In grade 2, the rebound is less than 15 seconds and the pit is 3 to 4 millimeters. In grade 3, the pit is 5 to 6 millimeters and the rebound is greater than 15 seconds. So it takes greater than 16 seconds but less than 60 seconds, and it is 5 to 6 millimeter. And in the grade 4, the pit is 8 millimeter and the rebound time is 2 to 3 minutes. So 2 to 3 minutes, this is around 15 to 60 seconds, this is less than 15 seconds, and this is an immediate rebound. And you can see the depth of the pits. Now moving forward, pitting versus non-pitting edema. Pitting edema is in which the digital pressure leaves a persistent indentation. So the pit is going to persist. For example, in this case, you can see the dimple or the pit, it's going to persist. So there's a persistent indentation. That is what we refer to as pitting edema. The mechanism is accumulation of free mobile interstitial fluid due to, very important, due to increased capillary hydrostatic pressure or decreased plasma oncotic pressure. So hydrostatic pressure increases and oncotic pressure decreases. Now the causes, increased capillary hydrostatic pressure, the causes are congestive heart failure and venous insufficiency. But venous insufficiency usually, yeah, venous insufficiency also comes under increased hydrostatic pressure and decreased plasma oncotic pressure. That is because of the renal failure, liver cirrhosis, nephrotic syndrome. Characteristics: it's soft, compressible, indentation remains for seconds, skin usually is normal in texture. In non-pitting edema, there's no indentation that remains after the pressure. So after the pressure is removed, there won't be any indentation. That is non-pitting edema. The mechanism is accumulation of protein-rich fluid or mucopolysaccharides. Fluid is bound in tissues, not freely mobile. Causes are myxedema. Myxedema is basically a consequence or it's a symptom of hypothyroidism. And in myxedema, there's increased quantities of hyaluronic acid and chondroitin sulfate bound with the protein, and it forms excessive tissue gel in the interstitial spaces. So basically, it increases the quantity of the interstitial fluid. So there is mucopolysaccharide deposition, which mucopolysaccharide exactly hyaluronic acid and chondroitin sulfate. And also lymphedema. Lymphedema is basically lymphoid or lymphatic obstruction. This usually happens after post mastectomy. Mastectomy is basically the removal of a part of breast, a tissue of breast, or the complete breast. And filariasis. Filariasis is basically it's a parasitic infection. So you can see in this diagram, if I try to enlarge it, you can see it's a parasitic infection and it results in these elephant looking like legs. Now, moving forward, the characteristics of non-pitting edema are firm, rubbery skin, thickened, non-pitting pressure. So this is a table for comparison. You can see that pitting edema, indentation or pressure is present, it's absent in non-pitting. Type of fluid is free fluid, but here it's protein bound because it is bound to mucopolysaccharides and it is immobile. Tissue consistency in pitting edema is soft. In non-pitting edema, it's firm. Examples of pitting edema or the causes for pitting edema are chronic congestive heart failure, chronic renal failure, liver disease, then venous insufficiency, and here it is myxedema, which is because of hypothyroidism, and lymphedema, which is lymphatic obstruction, which can occur post mastectomy or filariasis infection. So yes, that's pretty much it.